Welcome to the Power of One. Today, I am going to be speaking with Chris, who is the Executive Director for the Penn CAC. We're going to learn all about that CAC, what they do, how you can be connected with them with their amazing walk that they have coming up. Welcome to the show, Chris. Please tell the viewers all about your history with the Child Advocacy Centers.
My pleasure. Thank you for having me. I am currently the director of Children's Advocacy Centers of Pennsylvania, which is the state association that supports the 40 children's advocacy centers we have across the state, and then also works to develop CACs, as we call them, in counties where we don't have programs. And I've been here for 5 years. And prior to that, I served as the executive director of the Philadelphia Children's Alliance, which is the CAC for Philadelphia, for 28 years. So I sort of began there before we knew exactly what a children's advocacy center was going to do. And gradually we evolved from a small, three-person staff in a walk-up facility to a co-located center housed with the entire Special Victims Unit of the Philadelphia Police Department and child sexual abuse specialists in DHS from DHS, and really expanded the number of children that we could serve, the number of programs that we offered. And now I'm honored, to be supporting all of our centers across the state as they serve children and figure out how to build their capacity and how to add some program components to their services as well.
And which I think is amazing. I did not know too much about the CAC world, and I would speak to Vicky periodically at the
Mhm.
Philadelphia Children's Alliance, and I didn't know the full scope of everything until I was employed for a period of time at Nova
Yep.
in Bucks
Yep.
County and oversaw the CAC. And I think the Penn CAC is amazing. All of the trainings that you offer are just outstanding. So why don't you walk the viewers through what exactly a CAC does and when they become involved?
Absolutely. My pleasure. Okay. So, Children's Advocacy Centers, CACs, were originally founded to improve the response to child sexual abuse cases across the country. There was a prosecutor who recognized that those cases were very difficult. Children didn't want to talk about what happened. They maybe didn't disclose until several years after the abuse took place. They were embarrassed. The dynamics of child sexual abuse made it really challenging for investigators to figure out what happened and then take steps to keep children safe from future abuse. So gradually, CACs have evolved to also serve physical abuse cases, but the way it was set up originally, when there was an allegation of abuse, specifically sexual abuse, so many different people had to talk to children. So you had law enforcement and child welfare and prosecution and medical providers, and they were all questioning children about the same incidents, but they weren't working together. And this prosecutor had a case, and the little boy said to him after the prosecutor interviewed the little boy in preparation for trial, the little boy said, "Why don't you grown-ups talk to each other?" And a light bulb went off for this prosecutor who looked back in the file and saw that the child had been interviewed 5 or 6 times before the case was brought to him. And so he thought, wow, when you combine the dynamics of child sexual abuse, kind of the embarrassment, reluctance to disclose, kind of not really even understanding what happened, with the number of people that might intervene and question the child, and then with kind of a whole lot of cases coming in. Cases increased throughout the late 80s and into the 90s. Child sexual abuse became something that was more talked about and resulted in more reports. When I was in Philadelphia in I think our peak year, we saw like 1,700 kids for forensic interviews, and that is a lot. So our systems were trying to respond appropriately, collaborate, and also with this volume of kids coming in. And so the around the country we were all having the same conversation. What can we do to improve this process? And we came up with the CAC model, and I'll jump into it. It really is, first of all, a mechanism for collaboration among all the agencies that I listed earlier. So there are protocols and policies in counties in Pennsylvania that say this is how we're going to work together. When a report comes in, these agencies will convene and collaborate on their response. So the first thing is collaboration, not duplication. And then the second component was interesting. It was this forensic interviewing concept, the idea that people who are questioning children about allegations need to be highly trained. They need to understand memory and suggestibility and how to frame questions so that they're open-ended and not leading. And at the same time, they need to be compassionate. And so this whole field arose over several decades of forensic interviewing of children that is really considered best practice today. And it involves a lot of training, a lot of peer review, a lot of ongoing support. So forensic interviewers, not anybody can be a forensic interview. It really does take a lot of support and training and ongoing peer review. So that when kids come in, the interviewer questions a child while law enforcement and child welfare watch behind a mirror, a one-way mirror, or on a closed circuit TV to reduce the number of times that kids have to be interviewed. But then those interviews are recorded and they can be used. Law enforcement and child welfare can go back and review the kids' statements. They can be used in court to show exactly what the child said. And that was a big change. We started implementing interviewing not until after 2000, I think, in Philadelphia, interviewing with videotaping. And then there's a standard of victim needing a victim advocate. So our standards require that a victim advocate be able to meet with a non-offending caregiver and then be available to support the child through and their caregiver through any follow-up, maybe connecting to therapy, understanding the court system if the case goes to court. And so that victim advocate is often a staff person at the Children's Advocacy Center, but sometimes is a partner agency that works out of the CAC. And then medical exams, ensuring that high quality evidence-based exams are conducted by pediatricians who have been trained. I just pulled some quick statistics, and in 2024, there were 10,900 children interviewed at a CAC somewhere across the state. So all of our CACs collectively interviewed almost
Mhm.
11,000 kids, and almost 5,000 of those kids had specialized medical exams. And a
Wow.
lot of times, as you know, Melanie, there isn't any evidence, any physical evidence, but we need to rule that out. God forbid we should send a child home who actually had some sort of medical finding. And the doctors and the sane nurses, they are so good at reassuring kids that their bodies are okay, and to answer any questions that children may have and to reassure them. So we have the forensic interviewing, we have the victim advocate, the medical, and then therapy. We've learned also over the past 20 years, about the impact of abuse on kids long term on their mental health functioning. The ACEs study, some of your listeners may be familiar with the adverse childhood experience, where there seems to be a very strong correlation between trauma in youth with long-term health and mental health outcomes, negative outcomes. So we wanted to make sure that although we were focusing on a high quality investigation, we were also focusing on long-term supports for children and families so that the abuse didn't become a life-defining event. And then the CAC is a child-friendly, welcoming facility. Cases are tracked through the system so that families have support at every step. And then there's also prevention work. In the past 5 years or so, CACs have gotten more into prevention, going out to schools, talking about child sexual abuse, how to what to do if something happens to you or how to prevent it. And so we're doing more prevention work, which feels really empowering, right? To get out there and try to stop this from happening in the first place.
And that's awesome. I did read a book. I can't remember the name of the book, but I was floored because, well, we say 8 or 7 times out of 10, it's not a stranger that will molest or
Right.
sexually assault a
Yeah.
child. And when we think about that, and this book raised awareness to me, because what
Mhm.
do you tell your children? Watch out
Mhm.
for strangers. Don't talk to
I
strangers.
know. We do,
So
don't
I was
we?
really floored. Yes.
Yep.
So speak to that as far as like, I know you just said you pulled some statistics, but you don't have to give me some statistics on how siblings and family members
Yeah.
sometimes prey on younger family members.
Yeah, absolutely. I was shocked myself to learn that. And we do track our data around the number of kids who are abused by family members, and sometimes it is more than half, more than
Mhm,
50%. It's tricky to, um, it's hard to comprehend, but
mhm,
yeah, it is not the stranger in the park. It is almost always someone the child knows. And then a little bit, the statistics are a little bit less with an actual family member, but the statistics are very high. And I think for caregivers, it behooves them when they're, maybe talking to kids about their body is safe and no one should touch their body, and they should certainly not refer only to strangers. I think when that happens, kids then are afraid to disclose because they don't think anyone will believe them that it was someone they knew or a family member.
mhm. And a lot of people who are not in the work that we're in with victim services, sometimes they'll hear something on the news and it'll say this happened in, I'm going to say 1989, but they're just
Mhm.
coming forth with a sexual assault. A lot of people don't understand
Yeah.
when that happens, it rocks your whole world. They're
Hmm. Hmm.
embarrassed. They don't want to come
Hmm.
forth. And especially,
Hmm.
and maybe you can speak to this, when it's a male victim and a
Hmm.
male offender.
Yep. Yep. So right. The male victim and the male offender, I think just for the victims, it just makes it even that much more embarrassing, maybe, and concerning. And they may worry that they're gay or think that they're gay. And it just is a couple more layers of complication um, around coming out and disclosing. So many, the majority of victims don't disclose. If they disclose at all, they don't disclose until adulthood. There's a fabulous
Mhm.
website, Darkness to Light. You may have heard of it. If anybody just puts in Darkness to Light in the computer, it will come up, and they have a lot of great statistics. And when people do disclose, they did a study that looked at what made them finally disclose, and it was access to someone that they trusted or access to someone that they thought might believe them. It was a realization at some point that what happened to them was not normal and wasn't something that happened to everybody when they were a kid. It might be because they have so many emotional struggles because of what happened that they just feel like they need to reach out and get help. And that's often in adulthood. And they want something done. Sometimes they reach out because they finally think, wait, this shouldn't have happened. I shouldn't be carrying all of this burden. The alleged perpetrator should be. And then when they come out, they do expect to be believed, which sometimes isn't always the case, unfortunately. But we hear from so many adult survivors who support the idea of the CACs of really helping kids get on a path to healing, to help them be safe, stop the abuse, get the supports that they need, and put them on a path to healing so that they don't have to go through what the adult has gone through, adults who were abused 40, 50 years ago and now feel like they have the courage to come out and talk about it. And they are great supporters of our children's advocacy centers because of their own experiences.
Chris, is there a time frame as to when a child can disclose maybe to a counselor or a teacher? And walk us through that process. If you have a child that may say to their counselor or a teacher, something happened to me, then
Mhm.
what happens? How does it get to DHS? How does it get to the Child Advocacy Center?
Right, right. So if a child discloses to someone at a school, they're a mandated reporter, and they would file a report with the Child Welfare Agency. In Philadelphia, it's DHS, and most of the other states, it's Children and Youth. And then Children and Youth would get the report, and based on the disclosure, they would probably cross-report to law enforcement. Sometimes kids disclose and someone reports it to police first. And then if police get it first, they cross-report to the Child Welfare Agency. And that's assuming, so for a case to go to DHS, the alleged perpetrator has to meet the definition of a caregiver under state law. So if it's someone who's in a caregiver role over the child, DHS would be involved. If not, if it's someone who was maybe a neighbor, but they didn't have a caregiving role, it might just go to law enforcement. But either
Mm.
situation can come to the CAC. And then we have protocols at all of our in all of our counties that once either of those two agencies gets a report, they would then contact the other agency and then schedule a forensic interview at the Children's Advocacy Center. Prior to that, they may have to go to the home in the first 24 to 48 hours to do what we call like a minimal facts interview to just gather some basic information before the child would go to the CAC, where they would be interviewed that day. They would meet with the victim advocate. They may have a medical exam the same day, or they may go to a hospital, depending on what county they live in, where they do the specialized exams. And then the team, the partner agencies will get together and decide what the next steps are. Is there going to be further intervention? Is there going to be a referral for mental health? Is there going to be an arrest? There are lots of different directions that a case can go in, and those team members will work together. So they'll share information, they'll be together at the CAC talking about what they already know. Maybe DHS already knows this family. Maybe the police have a prior record on the alleged offender. And they all put their heads together and share that information so that they can make the best decision for the child and family moving forward. And then depending on what happens, if the case goes to court, the victim advocate might provide court accompaniment. If the case doesn't go to court, there may be reasons for that, but that doesn't mean the child can't have therapy and support from the victim services at the CAC. So it's sort of a wraparound service, and it includes all of those components. And then, the caregiver can certainly stay in touch with the victim advocate in case maybe the child finishes therapy and it's successful, but a year later something happens and they need help again. The children are welcome to call back to the CAC and ask for additional support.
That's awesome. I love the collaboration and not duplication. That is so, so important. Tell me, do you know the first child advocacy center in PA?
The first CAC and PA, I think we might have some disagreements about that, but there was a program in Pittsburgh at a child's place that started in the late 80s, didn't call itself a CAC, didn't have all of those components, but eventually became a CAC. The Philadelphia Children's Alliance, I think, was the first formally accredited CAC in the state of
Okay.
Pennsylvania. So it kind of depends on how you define it. Either way, we were all doing something similar. We had a center in Scranton, we had a center in Harrisburg, and we came together in the mid 90s just to talk about, wow, what are you doing? What are you doing? And that's how we started our state association. It was a very fledgling group without any funding, but we, just started comparing notes. How many cases do you see? How are you
Mhm.
getting buy-in from law enforcement and child welfare? How does that look? Where do you access your medical exams? Who's doing your therapy? Comparing notes. And that was incredibly helpful. Although it is amazing to see how far we've come now with 40 centers across the state and many, many more resources for kids and families.
Yeah, and I will say that all the CACs throughout PA is awesome. The ones that I met at the Penn CAC trainings and things like that,
Mhm.
everybody is just wonderful and so sweet and works so well
Mhm.
together. Which county in PA has the highest numbers?
Yeah, it's definitely, it's a bit of a tie between Philadelphia and Pittsburgh. Now, Pittsburgh
Mhm.
has a smaller population than Philadelphia, but they serve multiple counties around Pittsburgh. So there are
Okay.
smaller counties, and Westmoreland County isn't small, but that's part of it that they serve. So those two agencies are about the same in terms of
Okay.
the number of kids that they serve. Those numbers go up and down a little bit,
Right.
but generally it's the two larger urban centers. But we also really focus as the chapter on supporting the rural communities because they have their own
Mhm.
set of challenges, right?
Yeah.
Just geographic challenges, getting to the location of the CAC, having enough expert resources in the county. And so even though they're seeing many fewer cases, sometimes the challenges are equal or bigger because of the rural nature of the community. And we want to make sure that every child in the state has access to a children's advocacy center no matter where they live. And we want to make sure they have access to a CAC in a reasonable amount of time, right? That they don't.
Understood. Yeah. Oh, for sure. For sure. So the Penn CAC has a walk coming up. Tell the
We,
viewers about that, how they
we
can register and how they can participate.
Okay, so yes, it's the Shine Walk, and this is our fifth annual, and it is a walk through Harrisburg that ends on the steps of the Capitol, and we're shining a light on the issue of child sexual abuse. We're shining a light on the stories of survivors. We are marching and speaking out because some kids still can't speak out, and we have the shine, the yellow theme going on and just want to bring attention to an issue that too often, it sounds kind of cliche, but too often hides in the shadows. And then we'll celebrate at the Capitol we're having a luncheon afterward for all the walkers. And so I'll give you the information that you can post to the website for folks to go to register. And we also have a survivor speaking at the end of the walk. Sasha Newlinger, he lived in Montgomery County. He was abused by a relative, and his family did a lot of video work when he was little. So he put together a movie about his childhood that includes, how the abuse came about. So he is speaking at the end of the Shine Walk. So yes, it's on the 19th, starts at 11 a.m. in Harrisburg at City Island, walks across over to the Capitol steps, and then into the building for the presentation and the lunch. And again, really just trying to shine a light on this issue that doesn't get enough exposure.
Well, Chris, I want to thank you so much for joining me today. I want to thank everyone who works at the CACs in
Yep, they're
PA
amazing.
around the world. Yes, all of you are doing amazing, amazing work. And Chris, I will see you in Harrisburg with my yellow on. I am
Oh, I know
psyched
you
and
will.
I'm excited. Thank you
Fantastic. I
so
can't
much.
wait. Thank you so much.
You're welcome. Thank you for joining me today.
My pleasure.
Thank you so much for joining me today. I hope you learned a great deal about the Penn CAC and how they can help you. They have the most amazing trainings. It's always good to learn. You have to learn something new every day. Peace and love.